Good evening, learning friends. Good evening, Denis and Siobhan. I'm very glad from Clermont-Ferrand to present to you one of our learning programs dedicated to the youngsters. Clermont-Ferrand has always regarded the health of children and their well-being as a top priority. Our political guidance, the city measured up to the child, requires an operational city school health service in all the schools of the city. In the current context, where social inequalities and restricted access to care are increasing, reinforced by the COVID-19 crisis, the political will of the mayor of Clermont-Ferrand, Mr. Olivier Bianchi, is to develop corrective and concrete actions supported by this service. School nurses are an asset in terms of screening and prevention in the health field, but are also an invaluable support for children and their families. As a UNESCO learning city, Clermont-Ferrand intends to apply the learning process in all of its strategies. Teach a child the basic rules of hygiene while having fun means making sure that when he returns home, he will continue to apply them, he will want them to be applied by his brothers and sisters and often by his parents. Today, during these pandemic times, we are able to observe the essential role played by children as devoted civil servants within the population. Each one keep a watchful eye on the respect of good practices and the compulsory wearing of masks. Children, when we listen to them and observe them, teach us how to communicate better with them. It's precisely by considering children as transmitters of knowledge that our nurses invent innovative and efficient programs for extending to them crucial knowledge about nutrition, the necessary to combat all forms of discrimination or violence. We do not consider that the school should be a place of selection, a place where a child could be left in a situation of school failure. Behind every dropout, there is a child who suffers, sometimes even in silence. Glasses adapted to his vision, an early diagnosis of his hearing disorders, or person to what is grouped in French under the generic name of dyslexia, dysorthographia, and so on, can allow him to resolve his learning difficulties. School nurses, because of their profession, are also excellent sentinels for perceive a feeling of insecurity and anxiety, which may be due to the social or family environment. Thanks to them, we take better care of children with health problems, diabetes, allergies, and so on, and their food prescriptions. In Clermont-Ferrand, approximately 450 children are concerned. In France, a child dies every 5 days, victim of the violence of his parents. Identifying children in danger is therefore an absolute necessity to avoid the tragedy. Sometimes, children are also collateral victims of domestic violence. Without going to these extremes, for any mistreatment whatsoever, physical, psychological, each mistreatment has a strong impact on the development of the child. The results of the latest surveys are terrifying. 14% of French people say they have been victims of violence during their childhood. 60% of them say they have not talked to anyone about what they suffered. Last week, thanks to their vigilance, 5 alerts were launched in order to better protect concerned children and start working with their parents and legal authorities. As we can see, a school health service closer to children, nurses present in schools are important assets for real public health policy. Thanks to them, a poorly cared child is often growing up in a poor family or in a heartbroken family, sometimes both. By working with all the public health key players present in our territory, nurses contribute to the well-being of the inhabitants of our city. Thanks again for your attention.